The last 2 years may have caused pandemic fatigue, but we survived and thrived even if the crisis was not over yet. Our experience during the pandemic has intensified our creativity and resourcefulness. This global crisis accelerated our innovative minds and has mobilized us to improve our service offerings and introduce new products and services to meet the emerging needs of our patients. On behalf of the VRP Medical Center Board of Directors, Executive and Management Committees, I present the year 2021 in review. This President's Report contains the collective highlights of 2021 based on business performance, best practices, learnings, and annual reviews, including foresight and strategic plans for 2022. We began the year with our 40th founding anniversary in February 2021. In an unprecedented time of history, 1 year and counting of community quarantine have reshaped how we do things in the new normal. For the very first time, we held our annual week-long anniversary activities virtually. We started the week with an online Thanksgiving Mass and awarded our loyal employees and other special recognitions. Then, we conducted the activities all virtual for the rest of the week. Thankfully, it was less challenging for us since we had been used to holding events online during the first year of the pandemic. We had the same energy and spirit of a real-life celebration. The apparent involvement of all our employees and doctors during the week-long celebration was phenomenal, just like how we celebrated our anniversaries pre-pandemic. So 2 years in the pandemic, the year 2021 was a time of extended uncertainty and volatility affecting the revenues and census of the hospital. We had a challenging year, but we are not totally broken down. Our gross revenue was slightly higher than 2020. We grew 11% versus 2020 gross revenue. Our gross profit increased by 12%, with 1% short of our target. Net income also gained 100% growth from 2020 and 23% higher than target, as we also managed to achieve general and administrative expenses 22% lower than our budget. The ongoing global health crisis strongly impacts our organization, as we do not expect the situation to improve anytime soon. It will take some more strides to catch up with our pre-pandemic status. Our hospital was at full capacity whenever community transmission of coronavirus was on the rise. This was seen in March 2021 when the Department of Health reported the highest daily record of new cases since the pandemic began. And again in September, which recorded more than 20,000 new cases per day, driven by the highly infectious Delta variant. However, patient census was lower than usual on ordinary days. We understand that the low census was due to the reluctance of the general public to visit hospitals for medical treatment and urgent care for fear of catching the virus in the facilities. However, we believe that as long as we continue to find creative ways to attract patients, we can bring back growth trend in 2022. We will continue working diligently to provide the Alagang VRP experience for all our customers so that we may recover from this challenging time. Responding to the pandemic was a big undertaking with challenges. Yet, we continuously improve and innovate amid the crisis we encounter to mitigate the unpreventable odds. We rebounded with a hospital recovery plan following the 6 keystones which we have started implementing since early 2020. These are strengthening infection control, leveraging information technology, efficient internal and external communication, increasing revenues, cost management, and cash flow management. On infection control, patients and health workers' safety is a foundational priority. In anticipating the launch of the National Vaccination Program by the Department of Health, we had already formed a vaccination team headed by our infectious disease specialists with the Infection Prevention Control Committee. Less than 3 months since the national launch of COVID vaccination, almost 90% of our healthcare workers have already been fully vaccinated. And before the year end, we were 96% fully vaccinated. On leveraging IT and remote care, people were looking for alternative channels to access care. They were willing to engage with digitization, which served as a lifelong for continuing care and provided a new level of convenience to the patients. To meet the emerging needs for digital health solutions, we developed and strengthened our services such as e-consulta, tele-rounds, COVID home care, tele-rehab, Care Connect patient portal, and countless payment systems. We also expanded our remote care by offering home services for laboratory tests, including doctors' home visits. We started the product development of the mobile health clinic for possible launching for year 2022. On efficient internal and external communication, we have also mastered the platform by conducting several webinars for medical and non-medical talks, lectures, town halls, and ad hoc meetings. This initiative enables us to strengthen our internal and external communication lines to engage our employees, our doctors, our patients, and other stakeholders through virtual engagements in 2021. Our ability to communicate and listen openly is one of our most distinguishing strengths. This open communication model allows us to respond and decide quickly and on point to every call to action. We are committed to implementing whatever it takes and when it needs to be done to begin and complete each project successfully. As necessary, we readily create ad hoc group chats and virtual rooms that bring everyone on the same page. In addition, the management cycle of 360-degree reporting, deliberations, approvals, implementation, monitoring, controls, audits, and reviews is a prevalent integrated communication niche that works efficiently and effectively for our organization. So everyone has evolved and has risen to face the challenges that made us more creative, innovative, and resilient. We have been working hard to develop new products and services to meet the emerging needs of our patients, employees, and our other stakeholders. So as a result, we are happy to share our portfolio with product development breakthroughs and continuous service improvements. As we follow the mandate of the Interagency Task Force for the Management of Emerging Infectious Diseases, we still held our board meetings virtually. To set up never became a barrier to passing corporate resolutions. In 2021, We passed 16 board resolutions and 81 action points by the ExCom to approve the appointments and the renewal of contracts and accreditations of medical and non-medical personnel and support groups. We also decided on purchasing the necessary equipment with all due diligence on the cost and cash flow management. The following slides and pages of the 2021 annual report will present the performance highlights and milestones of the hospital administration and medical departments. One of the highlights for employee assistance was the grant and release of the Department of Health Special Risk Allowance amounting to 6.2 million pesos to all our healthcare workers. We also assisted our healthcare workers who contracted COVID-19 for DOH COVID compensation with 41 approved applications of 15,000 pesos cash benefits each. The community pantry became a paramount bayanihan movement during the pandemic, shortly after its debut, which led many others to put up their own. We also had our simple version of employee pantry, with food donations from the Mancom, from our doctors, sponsors, and our own employees. Another highlight was our performance in operating an efficient health system with the highest possible standard and uncompromised quality. We are very happy to report that we received ISO RES certification for quality management system and environmental management system with flying colors. At the same time, we received ISO certification audit for occupational health and safety management system. According to some economists, the healthcare sector is expected to grow in 2022 as COVID restrictions began to relax after the progressive national vaccination program by DOH. Analysts also say that consumers are likely to stick to digital care, preventive care and wellness, mental health, and interest in value for the money. Considering this consumer behavior in the next normal, we will continue to innovate and develop new ways to attract individual and corporate customers to bring the annual report back into a positive growth next year. We are optimistic about the future with our strong management team and stakeholders who can adapt to the changing market environment and help us achieve our goals. We will also be looking at new products currently in development and how we plan to recover our patients back to the hospital for their preventive and elective procedures. We have come a long way since the pandemic started in 2020. But our work is far from complete. We are committed to serving our customers by providing solutions that address both COVID and non-COVID related medical needs, among other things. As we complete this annual report, we get ready for the goals and imperatives for the following year. We will march on in providing the highest quality of healthcare services in the next normal, as we have proven through our 48 years and counting in existence. We will continue to live up to our vision, our goals, and commitment. Everyone in our organization is an integral part of fulfilling our service imperatives for operational excellence, profitability, and community service, ready for the next normal. We will remain committed, innovative, and engaged as we face the new fiscal year. So, thank you for your continued confidence and support in implementing our plans of action for 2022. May God bless us all, and thank you so much.